Welcome to Tissue Healing and Recovery. Now, this presentation is for some a recap on the stages of tissue healing and recovery, or if you've not come across this before in your training, this is a great way to understand a little bit about how the tissue heals, then also how kinesiology tape may help at different stages of healing. So maybe it's a recap for you or a brand new topic to focus on. Phases of tissue healing. Tissue healing is all about regeneration and repair, and during this process there are four main phases or stages that your patients will need to go through to heal after an injury. And the time frame for these aren't textbook, and it will vary depending on many factors such as how well their tissues heal and the severity of the injury. But it gives you an idea of where your client or patient may be along this spectrum. This slide is just about an overview of the four stages or phases, and we'll break each one down individually. But let's have a quick look at the time frames. So the first one is the bleeding phase, so the very initial stage after injury, and that lasts for 4 to 8 hours depending on the client and the injury. The next phase we have is the inflammation phase, which happens around the first 2 to 3 days and can continue up to several weeks after injury. Next is the proliferation stage, which will begin around 24 to 48 hours, right up to 2 to 3 weeks after the injury. And the final stage is a remodeling stage, and this happens around 1 to 2 weeks post-injury and can continue up to 18 months after the initial injury. So let's begin breaking each one down individually. The bleeding phase. So within this phase, there are two main stages that the healing process has to go through. So the first one is to stop the bleeding completely, and the second one is to create clotting to keep the injury into that local area. So the first process, which is stopping the bleeding, is hemostasis. And what happens there is that bleeding stops, histamine is released, which creates that swelling, which then allows the platelets to be activated, and then a whole load of enzymes are released to the area to then move into the clotting phase of healing. The platelets are exposed to the collagen within the area, and they create that platelet plug, so the clotting around that area. And what that clotting does, it restricts and obstructs the lymphatic fluid drainage, which then helps the localized injury within that area. And those enzymes work together to really coagulate, to really localize the injury and create that clotting process. The next phase is the inflammation phase. Now, just a note that inflammation is completely normal and it's a necessary process to help with tissue healing. So it's important that we have that within our healing processes. So inflammation is not bad. And what that inflammation does is it initiates that healing process. It keeps that injury localized and contained, and it will gradually resolve itself within 2 to 3 weeks. But it is a normal process that has to happen. So within the inflammation phase, we have macrophages, which are white blood cells, and they arrive in the area and they mop up and remove any debris and bacteria from the injury site. Think of them like Pac-Man, picking up all the bits along the way. So they're removing any extra debris and bacteria from that injury. And what they also do is they release growth factors and cytokines, which are then involved in the proliferation phase. And what happens is when there's less oxygen to the area, macrophages are stimulated to create a process to help increase local blood flow and circulation to the area. The proliferation phase. So this process is all about restoring tissue with laying down of brand new tissue. And it goes through 2 stages during this process. The first one is fibroplasia or fibroplasia, and this is where the fibroblasts lay down new type 3 collagen. So fibroblasts are connective tissue cells and create new collagen. So they create type 3 after an injury. And we'll talk about collagen in a few slides' time, but just to mention that type 3 collagen is a lot weaker and less flexible than the original tissue. But it's the first process to restoring that tissue. The second stage in the proliferation phase is angiogenesis, and that is about creating new blood cells and new blood vessels. So in this area, the capillaries around the injured site start to bud and they grow towards the actual injury itself. And then this then re-establishes blood flow to the area, bringing important nutrients to that injury site. And one of those important nutrients to consider is oxygen. So we need oxygen to help with the healing process. So someone is a poor wound healer if they have a poor diet, or as an example, they are a smoker, then this process will be restricted. And the next phase is the remodeling phase. And this phase is all about remodeling the newly laid down connective tissue into mature scar tissue. So the type 3 collagen, so the weaker collagen that's initially laid down, is reabsorbed by the enzyme collagenase, which then turns into type 1 collagen, which has a lot more tensile strength. Type 3 collagen is also really disorganized, so this process helps reorganize the type 3 collagen into type 1, and then that type 1 collagen is orientated to the lines of local stresses or mechanical stresses, depending on how that person moves or doesn't move. We're going to talk about the local lines of stresses alongside collagen. So the next slide we're going to come into is all about what collagen is and why we need it in our tissues. Collagen. Collagen is the most abundant protein in the body, and there are at least 15 different types of collagen that have been recorded. However, the Cum-Cara-Bona study suggests there are at least 25 different types of collagen, so the research is still inconclusive. Type 1 collagen is the most abundant in the body, around 90%, and it's found within the skin, the bone, tendons, ligaments, and within the fascia. But fascia itself can contain an array of different collagen types, according to the Cum-Cara-Bona study, suggesting that it's not limited to types between 1 and 24. The shape of collagen is a triple helix shape, which gives it its tensile strength. And gram for gram, it's been suggested that collagen is stronger than steel. So it's a really strong fiber within the body. And it's also an example of Wolff's Law is a study by Taylor that found there was an increased amount of osteoblast production in a tennis player's racket arm as opposed to their non-racket arm. So the more that they were creating mechanical stress on that arm increased that cellular production, creating stronger bones. So therefore, it's really important that we create enough mechanical stress to help improve the quality of the repaired tissue if we're thinking about how Wolff's Law relates to collagen. So the next slide, we're going to look at unused tissue or unused collagen or immobilized collagen and collagen of tissues that is mobilized and used well. And as you can see here, there are 3 different images. So if we consider the importance of good stress on the tissues in terms of creating better quality of fibroblasts in the collagen, but also helping create good quality tissue that's been repaired, then we need to get the patient moving to create enough stress to do that. And if your client is patient is experiencing pain, the last thing they may want to do is start moving again. This is where kinesiology tape may come in as a modality to help patients begin to move and load the tissues. We'll talk about kinesiology tape and pain in the next online learning, but I want you to think about how by using kinesiology tape, which may help reduce pain, would then be able to help that client start moving a little bit more with less pain, which then creates enough load of the tissues to help create that good quality scar tissue and then reduce the risk of re-injury. The phases of tissue healing and kinesiology tape. So the last part of this learning is just about when to use kinesiology tape during that phase of tissue healing. So the first phase is the bleeding phase. Now, if there is an open wound and blood, then this is contraindicated. So kinesiology taping is contraindicated during this time. But if there is no open wound, then the lymphatic taping may help with this phase to create that offload to help improve lymphatic flow and blood flow. The next phase is the inflammation phase. So inhibition taping may be used well for muscle strains and tendon injuries, and then also the mechanical taping for the ligament injuries. If there are still signs of swelling, lymphatic taping can be continued to use during this phase. The proliferation phase. So all types of taping can be used within this phase, but it all depends on the goal and the intention and the presenting condition and complaint of the patient. And that goes with all of the phases. Always ensure that you're working based on your goal, your patient's goal, but also their presenting condition and complaint. And finally, the remodeling phase. So again, same as the proliferation phase, all types of taping can be used during this phase, but again, always depending on the client's presenting condition and complaint. And for a really quick guide on the type of tape for a particular injury, head to the rest of the online learning, and we have a free PDF download that you can print off and put within your clinic that will go through really quickly which type of taping is right for whichever stage of healing that your client may be in. And as we conclude this presentation, just a quick note on injuries and taping. So if your patient is presenting with a certain injury and you aren't sure or not qualified to diagnose, always seek some clinical advice for those types of injuries. Taping can definitely help with that recovery from injury, but if you aren't sure what your client is experiencing or patient is experiencing, always seek clinical advice. And then just lastly, always work within your scope and practice. And finally, just some of the references that we've discussed in this online learning.